recommend is plenty of color today. So I'm pretty consistent about my colors. So I use pink anytime it's alveoli. I use a brown anytime it's conduction zone. I use a light blue for air. Purple is pleura. There's a few more colors I'll use. Like I'll use orange is always elastic fibers. So you have these little rubber bands around your airways. And then maybe some brown and some green. But those are the main colors. I don't think maybe a darker blue at some point and a green for mucus, at some point. And hopefully you have 11 by 17 paper too. I'm gonna tilt my Wacom down, my tablet down, but you could get started by writing these across the top. We're gonna write these across. Notice they're gonna be across the top of all of our drawings. We have 4 pieces of paper, 5 different steps, but it'll take 4 pieces of paper. And again, I said this, we already went over test formats, but I'm going to say this again, that you really need to know the drawings in order to do the essays. You won't be able to get the essays down, or at least I'll know that they're not really based on an understanding of the physiology unless you really get the drawings down first. So it's not like the immune where you have to draw these on the test, but it is like cardiac drugs where you have to know the action potentials in order to do the essays. All right, so I'm going to try and catch up with you by writing the steps across the top. I guess I kind of want to create a cheat sheet so I don't screw things up. Okay, so we're going to write ventilation as step 1. It always does that. Always starts too big. Sorry, I'm trying to get my Wacom for some reason always starts with the wrong font, wrong size. I want to get it fine. Okay, so ventilation. That's from atmosphere or from the air into lungs, air into lungs. I really like respiratory because it does seem really complex, and obviously it's really complex the way it's affecting COVID, but it's also, you can break it down into little steps. And something I've probably said to you multiple times, but I'll say it again, is you want to be able to break things down into chapters of a book and study for 10 minutes at a time, maybe 20 minutes at a time, but spend 10 or 15 minutes on each chapter and then let it settle in so it becomes a story. The respiratory system is a beautiful story because essentially you're following an oxygen molecule. So this is going to be through blood. You're following an oxygen molecule along its entire path from outside your mouth to your little toe. And then we've got internal respiration. I'll say this multiple times because sometimes people get confused and they think external respiration is breathe out and internal respiration is breathe in, but internal respiration is from the blood. Come on now. To tissue. And then not everybody always treats it cellular respiration with the respiratory system, but I think it only makes sense if you're telling a story that you're going to follow the oxygen all the way. And so this is O2, CO2 to make ATP. So you're breathing 18 times a minute because that oxygen is being used in a chemical reaction to make ATP. All right, so the first thing we're going to do is draw some lungs, and I just use pink for lungs. Again, it certainly wouldn't hurt to redraw this if your drawing doesn't come out like laid out as like mine. But we definitely, like someone just commented a day ago that I write really small. Boy or girl?
It's a girl.
Awesome. What's her name?
Yep. She is 19 days now, and she is upset.
Congratulations. It's awesome. What's her name? If you don't mind saying.
It's Stella Joe.
Nice. I have an Ella Mabel and a Celie Grace. Cecilia.
Nice. Yep, them old names are coming back.
Yeah. We thought we were naming our kid something of a rare name, Ella. Like we've only met one Ella that's older than her, but then right after we had Ella, I think it was John Travolta named his kid Ella. So then it really took off. So I'm trying to draw lungs, and we're gonna put some airways in here. So. Obviously, it doesn't have to be a great drawing. And then we'll draw some alveoli. And again, those will be in pink. So those are going to be your air sacs. And then we might as well draw this too. There's going to be, if you have two purples are better, but you don't really need two purples. This one is going to be, it's called a pleural. So hopefully you've done your anatomy a little bit. Sorry, that was supposed to be on the outside. Pleural are layers that cover over the lungs. And there's two layers. There's one that's very tight to the lungs. And again, here's where Latin is a little bit nice. Parietal means up against the wall. Visceral means inside. And so just kind of switched my purples a little bit, but not a lot. So up against the thoracic wall would be the parietal. Parietal pleura. And then the one that's just slightly inside of that. Visceral means inside. So this is the visceral pleura. And then there's going to be a space between there. It's called the intrapleural space. So I jumped right into that, but should probably lay this out too, that one of the first things we need to talk about is pressures. So there's 3, maybe 4 pressures, depending on how you break it up. And then over here, we'll talk about something called Boyle's law. Sorry, I know that I know when I draw, it gets frustrating because you want to know how to lay things out. I might move this one over a little bit. And then we'll talk about something called Ohm's law. So another reason I like respiratory is because it uses some physics, and the physics really simplifies things. Okay, so let's go back and start doing pressures. And I always do air as kind of a light blue. So out here is going to be atmospheric pressure. So that's the pressure of the air around us. And that equals, and you're going to see I'm pretty redundant here, 760 millimeters of mercury. So our first pressure is atmospheric pressure. And we'll break down in the next drawing where that comes from. Most of it's nitrogen, but it's also oxygen, water, and CO2. And again, it equals 760 millimeters of mercury. And why you need to know that pressure, of course, is because air moves from high pressure to low pressure. We might even just, if we have space, we might even write that. Air moves from high pressure to low pressure. So we're going to change the pressures in the lung to get air to flow in and out. Here's where I like color coding. Slow me down. These are pretty complex drawings. The first two are, and our goal today is just to get those done. And then the next three drawings are pretty simple comparatively. So slow me down if I'm going too fast, or also if you find that you think I'm going too fast, then turn your camera on, and then I can see that you're still writing. So the next one is intrapulmonary pressure. Intrapulmonary pressure. And again, we're color coding, so we could write it up here. Again, I'm a big fan of redundancy. Write it multiple times, see it multiple times. That's going to be the pressure in here, in the alveoli. And it's going to vary just a very small amount, but it's going to vary from 759 to 761. Now that's pretty small, so I'll come down and write it down here too. So the way it's going to vary is if IP is 759, 759 is less than 760. And so we're going to breathe in. So again, that's where air moves from high pressure to low pressure. If you've made your intrapulmonary pressure 759, you're going to breathe in. Could write that as IPUL. If IPUL is 761, 761 is greater than 760, equals breathe out. So when we get over to Boyle's law, we'll talk about how you get it to 759 and down to 759 and up to 761. This next pressure is pretty important to prevent lung collapse. So it's called intrapleural pressure. It's the pressure in the intrapleural space. We're going to write a few more things about this because it's pretty important. It's usually 4 millimeters of mercury lower than intrapulmonary. So it's going to go from 755 to 759. Is that right? No, that's not right. To 757. And what it does is, I don't think you need to know how it does it, but the way it does it is the lymphatic system is hooked up to the intrapleural space, and so it constantly pumps fluid out of that space. And so there's a suction that's created here, creates a suction that offsets forces that make the lung want to collapse. And it's important to know those two forces. The first one of those forces is, I don't know, I just stick with pink anytime I'm drawing an alveolus. So the first one is, if this is an alveolus, so an air sac, and not using any particular blue here, I guess, but you line your alveolus with water. And all that water is cohesive. So let's just write water is cohesive, which means like if you spill water on the table, it forms droplets. There's hydrogen bonds between water molecules that suck water together. And so water is attracted to itself. And if it's in the alveolus, it's attracting the alveolus to collapse. And of course, how we offset this is surfactant. So surfactant is a soap-like substance. It's soapy. It breaks the hydrogen bonds in water, and so it makes water less cohesive. And so if a child is born too early, sometimes it doesn't make the surfactant yet, and so the lungs are prone to collapse. And so you give them a steroid to increase their development. The other thing that's happening, and this one's another important one, is again, if this is an alveolus, each of these kind of alveoli, each of these kind of balls is wrapped with elastic fibers, which I always do is orange. So there's these little elastic fibers that flow around these alveoli. Remember, elastic fibers are like your ear. Your ear is stretchy. Elastic fibers want to collapse alveoli. And this one's going to be a key. Can't remember what color I use. But this is going to be a key in emphysema. I always like mentioning it just because I think it's awesome. I think it's awesome how like platelets use serotonin. What's happening in emphysema is essentially you have a digestive enzyme that's put out by your pancreas. It's called trypsin. Sorry, a little slow on a Monday. It's called trypsin, but your lung also makes a little bit of trypsin, and it uses that trypsin. So in the stomach, trypsin, or in the digestive system, trypsin is very strong. I can think about it. This is so gross, but I'll say it anyway. When I was a kid, my dad liked chicken gizzards, which completely sound disgusting now, but it's a hard kind of meat. And so you have to have very powerful digestive enzymes to break that kind of stuff down. Trypsin is one of those enzymes. Your lung also uses a little bit of trypsin to kill and digest bacteria. But there's another hormone called alpha antitrypsin, and that basically keeps trypsin under control. It says, okay, there's not a lot of bacteria around right now, so let's not go haywire. But for some reason, alpha antitrypsin is really responsive to smoke. Smoke kills it, and so if you kill the antitrypsin, it doesn't shut off the trypsin, so the trypsin starts digesting all these elastic fibers, and so the lung becomes really compliant. I always like emphysema as an example of most people think that breathing difficulties are difficulty breathing in, but emphysema is actually a difficulty breathing out. You can breathe in just fine, but since those elastic fibers aren't there, the lung does not want to collapse after you've taken a breath, or it doesn't want to recoil after you've taken a breath, and so it's hard to breathe out. All right, so those are two important forces because, for one, if anything messes with elastic fibers, then that's going to cause emphysema-like symptoms. And also, if there's extra water in the lungs, then that means it's more cohesive, and that means it's harder to breathe. The last one we have is it's kind of the same, so I'll keep it the same color. And it's just called the transpulmonary pressure. Trans means across. So this is difference in pressure between intrapleural. Well, let's do intrapulmonary first. Intrapulmonary and intrapleural pressures. If trans equals 0, the lungs collapse. So normally it's 4. But if it ever goes to 0, and it could be a car accident where you break a rib, or I don't know, like MMA fighters will break a rib, and that could put a big hole in there, and that can cause a lung collapse, or it can be a small infection. It just doesn't take that tiny of a hole. I always think about like balloons. It only takes a small little hole for a balloon to equalize pressure. Small little hole between intrapleural and intrapulmonary, it would cause lung collapse. There's two different types of lung collapse. We don't really go into it, but and I always get them confused. Pneumothorax is when you've got fluid. I think I'd have to look it up, but you can either have too much fluid out here, and that's a particular type of pneumonia. Lung collapse. Or you can also have a lack of ability to get pressure in here. I think that one's called atelectasis, but I always forget that one. Okay, so our next step, a little mental break, take a drink of coffee. I don't really care that you memorize Boyle's law, but you need to know the effect of Boyle's law. And that is that pressure, like, I should do this in black, sorry. The pressure and volume are interrelated. And here's where, I mean, if you're going to do ventilation, you have to do Boyle's law. You just have to, because I really want you to get, well, the reason I started this off last week by introducing this section by saying, I just really like how there's something that goes wrong at every anatomical level when it comes to the respiratory. Like, you have to understand what's happening at the respiratory level. So the tissue level, you have to understand what's happening at the molecular level. So I'm going to draw an alveolus. So just draw one. And I'm going to use blue because that's air. And what I want you to get is break down the physics. Is we talked about this when we talked about blood vessels, is we said that when blood hits the wall of the vessel, that's what causes blood pressure. So in physics, what causes pressure is when something hits the wall. So when that molecule of air hits the wall of the vessel, that creates pressure. And then that air molecule is bouncing around and it hits over here, and that causes pressure. And then it comes over here, hits over there, and so that causes pressure. So the reason I'm taking this really slow is because you can really see what's happening in the alveolus and how that connects to an overall failure of the lung. Well, if we took this alveolus and we increased its volume, that means that ball of air is going to have more room to bounce around. And again, just breaking it down real simple. I hope it's not too simple, because an increase in volume is going to decrease pressure. And that is because now this little molecule, in the same amount of time, it doesn't hit the wall as often. So if it doesn't hit the wall as often, then it doesn't cause pressure, and so pressure goes down. And so if you increase the volume of the alveolus, it decreases pressure. So what this means is, I think we have enough room to say this, increased volume equals decreased pressure. And again, I don't think we want to write this, I'll write it and erase it, but why we care about it is because it relates back to this. If you want to get pressure to go down, you have to get the alveolus to get larger. And so then you want to think about, okay, what's going to make it hard to do that? Don't know if I'm always using the same pink, sorry. It's things like mucus. Mucus in the alveolus is sticky. So you're going to hear me say this 100 times. If mucus is sticky and you can't increase the volume of the alveolus, you can't decrease the pressure. And then down here, if you can't decrease the pressure, you can't breathe in. So these are going to be difficulty breathing in. And that would include things like fluid, because fluid would be more cohesive. Scar tissue is not very stretchy. So if grandma smokes and she causes that scar tissue to build up, scar tissue is not stretchy. So it's going to be hard to increase volume, decrease pressure, breathe in. Then one other one that we should put is surfactant, decreased surfactant. So the main place you'd have a decrease in surfactant is babies born too early. But you could also have the problem if you're in a house fire. Surfactant's pretty volatile. And so you can burn it off if you breathe in hot air. Whenever I talk about surfactant, it always reminds me of this movie, this really, really old movie called The Abyss, and they actually used to do this. They used to have like a liquid oxygen. Like, it wasn't liquid oxygen because I think that'd be too cold to compress the gas into a liquid, but it's a liquid that really holds oxygen really well. And so they used to try it for infants. What am I trying to say? For when babies were born without enough surfactant, they would fill the lungs with this fluid. Didn't work out actually, but it was interesting. And then the reason it reminds me of The Abyss is because The Abyss was a movie where they wanted to dive at deep levels, deep sea levels. And so they would, I don't know, I don't think it ever really worked, but they would breathe in this fluid. Okay, so now if we're going to decrease the volume of our alveolus, so we're going to make it smaller. So we're going to decrease our volume. Well, now that that air molecule is going to bounce around like crazy. So I'm drawing these little asterisks to say that's where we're hitting the wall, and that's what's causing pressure. So that is going to increase pressure. And so now, keep my color coding the same. I don't know why I made that blue, but now if you have a decreased volume, you have an increased pressure. And again, this is what you have to do. Don't write this line, but this is what you have to do to breathe out. So this one down here is going to cause difficulty. Oops, wrong color. I could have swore I switched. Difficulty breathing out. So what's going to do that? And I'm going to go back to orange because again, orange was those elastic fibers. And so that's really just going to be emphysema. And think that one through, that emphysema, you lose those little rubber bands. So now the alveolus has no problem getting larger in size, but it has difficulty getting smaller in size. And again, I like to just be redundant as heck. And so we're just going to write here, inhalation problems. Equals difficulty increasing volume. So difficulty and decreasing pressure. So difficulty breathing in. Realizing I shouldn't talk and write at the same time because I cut myself off. So there's some people on the test that always say, well, pneumonia causes an increase in fluid, therefore that increases the volume of the lungs. It's not that it increases the volume of the lungs, it's that it makes it difficult to increase the volume. So it's not like, even in COVID, it's not the fluid in there the fluid is definitely going to affect external respiration, but it's also, the main thing it's doing is it's making it harder for the alveolus to get bigger. And if the alveolus can't get bigger, then pressure can't go down. And if pressure can't go down, then you can't breathe in. Same thing with exhalation and exhalation problems are going to be difficulty decreasing volume. So difficulty, or equals, I could have put an equally instead of so. Difficulty increasing pressure, so difficulty breathing out. And we're going to talk about that when we get down to pulmonary function tests, how you measure that, how you measure if someone's having difficulty breathing in versus breathing out. So we're going to come over here to Ohm's law. And a lot of times I'll bring up Ohm's law and somebody say, isn't that just electricity? And it's true that Ohm's law is mainly used in electricity. It's current, it's what is it, V equals IR, or I equals V over R. But it's anytime there's a flow of something. So it's I, which is flow, is equal to change in pressure. So delta means change in pressure. So this means alveolar pressure. Over resistance. So here again, take your time and don't just memorize it as physics. Realize that, of course, everything, the flow of water, the flow of electricity, the flow of air, the flow is dependent on how much do you want it to move. So what's the change in pressure? Or in the case of electricity, what's the change in voltage? Divided by what's standing in the way, what's the resistance in the way. And the reason we want to be able to do that here is I probably should have color-coded this, but we'll color-code it this way. We'll circle this in brown, and we'll circle this in pink. Okay, so why pink? Come way back over here, and you're gonna write, let's see, everything down here is going to be the respiratory zone. It's called the respiratory zone. And this is alveoli, air sacs. But everything we've talked about so far is just how are the alveoli working. But you might have perfectly good alveoli, but you've got a blockage out here. And this would technically extend. Maybe I'll make that a little bigger. If you've read through the anatomy, you know that you're not in the respiratory zone until you're way down in the alveolus. Everything else is called the conducting zone. So this is airway. And the reason we made those colors is because you generally have two different types of disorders when it comes to the lung. There's something wrong with the alveolus, and therefore it's a problem with the respiratory zone. Or maybe the alveolus is working great, but the airway sucks. There's something blocking the airway. It's inflamed, like an asthma or bronchitis. Bronchitis, itis means inflammation. Bronchi means bronchioles. And so here's where it gets really kind of irritatingly confusing, because there's so many things that can be failing here. So these P disorders, pressure disorders, are mainly called restrictive disorders. So when you look them up on Wikipedia, they're going to be called restrictive disorders. And that's because something's is restricting the alveoli. Finally, textbooks talk about respiratory this way. But for the longest time, they wouldn't even break it down in this. I don't know. It bugs me when anatomy books don't at least have a little bit of a nod to where you're going. And where you're going is you're going to talk about these as restrictive disorders and obstructive disorders. They're also called alveolar disorders. So I started to say this and I might not have finished it. I apologize. I'm kind of not finishing sentences today. But it's frustrating because there's so many different names, because there's so many things that can go wrong. And then these can be called pressure disorders. So you have to get used to all these different terms that are all technically correct. These are problems with alveoli cannot change volume to change pressure. Might run out of room. These are also called respiratory. So I got one more. So hopefully you have a little bit of space over here. Respiratory zone disorders, because they are happening in the respiratory zone. And then last one, it's not used a lot, but they're called compliance disorders. I apologize. I know you can't do what I'm about to do. But again, it's one of those things where it sure wouldn't hurt to redraw things like this. I don't know. I just think there's something like, it's like when you're teaching your kid the ABCs. You use song, you use words, they look at your mouth. Something about drawing, listening, writing all at the same time gets things to go into your brain more. So this last one isn't used often, but it's called a compliance disorder. Compliance means like how well do you go along with something? In this case, it's how well does the lung stretch? And this could be the alveoli are too stiff, as in scar tissue, or stretchy, as in emphysema. Emphysema, the lungs are too stretchy. And you'll see that when we look at lungs this week. So I guess I didn't mention, we'll go over the test. I think we'll have to go over the test. You have to see your essay to see what you missed. So we'll have to do that on Wednesday during lab. And then also we'll do respiratory anatomy in lab. Okay, so that's the pink one. Now switch to brown. These are called obstructive. That's the main term, because there's something, obstruction of airway. So again, it could be an inflamed airway, could be cancer, could be bronchitis is fluid in the airway, asthma is inflammation of the airway, so fluid. These are called airway disorders because that says airway disorders, because the problem is with the airway. Airway is blocked. Here's what always gets me. So I used to do electricity. I used to do electrophysiology. I would study ion channels. So I used to really have to use Ohm's law a lot. So my problem here is this is a resistance disorder because it's a problem with resistance to flow. But resistance sounds a lot like restrictive, but they're the opposite. So it's called a resistance disorder because there's a resistance to airflow. But don't get that confused with a restrictive disorder, which means something's restricting the airway. And the last one here is a conducting zone, because the problem's in the conducting zone. That says problem is in conducting zone. Sorry, that's my phone. I'm realizing that it would have been nice to be a little bit redundant. And I don't know if you can squeeze it in somewhere, but these guys here would have been mucus, fluid, scar tissue, and decreased surfactant. Those are all restrictive zone disorders. And then the main one here would have been emphysema. There's more, obviously. And here's where it's, I don't know, give you a little mental break. Probably shouldn't open more software when my Wacom is doing okay, but so when you go to look for your diseases, you can look up, Wikipedia has restrictive or obstructive disease. And so I'm going to tell you that most of this is going to come from, so this is going to be scar tissue and maybe some inflammation. I don't know, this one's going to be pneumonia, so extra fluid. This one's going to be extra fluid. This one's really important because ARDS is technically what's killing people with COVID. Infant respiratory distress syndrome is that when the baby doesn't make surfactant. So you can kind of already see from our drawing that these are starting to make sense, because pneumonia is going to be fluid. Pulmonary fibrosis is going to be scar tissue. Pneumonia is going to be also mucus and things like this. So again, you can break down pulmonary disorders pretty quickly. if you know the keywords that pop up in our drawing. And our keywords for ventilation are going to be mucus, fluid, scar tissue, surfactant, and emphysema. But while you're like feeling a little confident there, not to knock that out, but one of the problems with, and you don't necessarily need to draw this yourself, but one of the problems with a disorder like pneumonia is you're going to have mucus in here, but you're also going to have mucus out here. And so the thing that sucks about that is these are going to be, and I don't even know what color to use now. Let's use something in between those two. I don't know. You're going to have what are called mixed disorders. It's not a good color, but, and these are going to be problems in alveoli and conducting zones. So if you've got mucus in your lungs, or if you've got, like, I think about asthma, technically pure asthma is only a restrictive disorder, is only an obstructive disorder. But a lot of disorders, like some of that inflammation will get into not only into the airway, but down into the alveolus. And so that's true of things like emphysema. The main thing it does is it breaks down airways, but it also breaks down alveoli and bronchitis. So I guess what I'm trying to say is it's already confusing because you have all these different names for things. And then on top of that, you mix them all together into mixed disorders. Okay, so the question now becomes, well, I'm kind of really disappointed that we don't get to do this, but we have the equipment to do pulmonary function tests. I'm going to write that in black. So D is going to be, our part D is going to be pulmonary function tests. So we have the equipment to do it, and it's pretty accurate. And if someone knows they have asthma, it definitely shows. Or if someone's been sick, we usually pick that up too. And so what we're going to draw here is a graph. And this is going to be time here. And this is going to be volume. And that's going to be in liters. I don't know why it draws a circle like that sometimes. So this would be 0, 1, 2, 3, 4, 5, 6. And there's going to be, I might cheat. There's going to be, I guess that won't help if I drew a crooked line in the first place. So we're going to draw 4 lines. One at 1, one at 3, one at 3.5, well, a little above 3. And then depending on whether we're talking about male or female, it can be anywhere from 4 to 6, so we'll go halfway. And what sucks is we would have done these in lab and you would have seen exactly what we're talking about. But to get your pulmonary function test, there's 4 values that you care about. You're like, after I breathe all my air out, how much air is in my lungs? How about after normal out, how much air is in my lungs? After normal in? So our equipment would get these 4 values. How much air is in your lungs when you take a breath all the way in? How much air is in your lungs when you take a normal breath in, normal breath out, and when you breathe all the way out? And so then what we would have you do is, I'm going to go back to blue because that's just air, is we would have you take a normal breath in, normal breath out. Technically, we would have had to do 5. But then we would have said, take a deep breath in, breathe all the way in, all the way in. Sorry, I'm acting like a respiratory therapist. All the way out, all the way out, all the way out. And so your breath waves would look something like that. Trying to make my line straighter. Oh well. So then there's different values here that matter. Like this one's gonna get kind of small writing. This value right here, I guess it's because they look like waves. But this value right here is called your tidal volume. And so that's normal breathing. Tidal volume is normal breathing. After you've breathed out a normal breath, how much air can you breathe in? That's called your inspiratory capacity. Like, how much capacity do you have? If you took a normal breath out, normal breath in, and then tried to breathe in more, that's your inspiratory reserve. How much more could you breathe in? How much air can you breathe completely? So you take a breath all the way in and then breathe all the way out. So the total amount of air that you can move is your vital capacity. Vital means life, like your vital signs. And then let's do the same down here. How much air can you breathe out after you've breathed out normally? That's going to be your expiratory reserve. So how much more in reserve do you have after you've taken a normal breath out? After you've taken a normal breath out, normal breath in, how much can you breathe out? That's called your expiratory capacity. Even after you've breathed all the way out, it's estimated that you have 1 liter of air left, and that's called your residual volume. We can measure that by having you breathe in something like helium and watching how much comes out, but this is usually about 1 liter. So after you breathed out all your air, how much more could you breathe out? After you breathe out all your air, how much is left in the lung that you can't get out? That's 1 liter. It's actually a pretty important number because it plays a role in things like CPR, because as long as you keep blood moving through the lung, you can still pick up oxygen. Okay, so there's one last one that we left. This one's probably the most important. But this is how much air is in your lungs total. So it's your vital capacity plus your residual volume. And this is your total lung capacity. And so that's called your TLC. You don't have to memorize this, but it's supposed to be 4.2 in females and 6 in males. That's how much air you should be able to move. So you can see then, and I don't know if we'll draw a whole lot here, but do you see where, I don't know if I want to draw over this. I guess I will. Ooh. But something like emphysema would make it hard to breathe out. Or something like asthma. Technically, asthma slows everything down. So technically, asthma does this as well. Makes it take longer. So I don't think you need to have those memorized. I'm just giving you an example of this is how pulmonary function tests would change. And it's usually pretty cool because we can do it in lab. I've said that about 5 times now. Sorry. Now, because asthma, technically some people with asthma, they can breathe in just the same amount of air. It just takes longer. So you have to do another pulmonary function test. And this one is called the FEV1 over FVC. So here, I'm going to draw another graph. This again is going to be time. And this is going to be airflow. And that again will be in liters. So what you're going to do, and I'm just going to dash it, is we're going to take this part of the curve And we're going to flip it. We're going to flip it on its side, sort of. So the curve is going to look like this. Come on now. So this is going to be our all in. This is going to be our all out. This is going to be in time. 1 second, 2 seconds, 3 seconds. So what you're going to ask the person to do is, it's called a forced expiratory volume. So you're going to ask them, well, let's do the other one first. We're going to do forced vital capacity. So you're going to have them breathe all the way in, breathe out as hard as they can. This is called a forced vital capacity. Vital capacity because you're taking an all-in breath and then an all-out breath. So it's all the air you can move. So this is FVC, and it's called forced because you're really supposed to work at it. Then you're also going to measure how much air did they move out at, I should have made this, I'm sorry, I screwed this up. This should have been 0, this should have been 1, this should have been 2, sorry. You're going to have them breathe out, and you're going to measure how much air did they breathe out at 1 second. So this is going to be called a forced expiratory volume at 1 second. So this is going to be called an FEV1. So this is going to be FEV1 over FVC should be greater than, now I always get it confused. I can't remember if it's 80% or 70%. I never remember, but it's one of those. Okay, so what are we actually doing here? So someone with a normal breath should be able to take, so like, let's say we'll pick on Gorsuch, since she's a volleyball player. She should have pretty good lungs. And so when she takes a deep breath in, she should be able to get 80% of the air out in 1 second. Whereas an asthmatic, someone with asthma, like DJ, I could still breathe out just as much air. So maybe I could breathe out just as much air, but it takes a lot longer. So this is asthma. So someone with asthma, it's like those Starbucks straws that are really large, trying to breathe through something like this. Or I'll never forget my grandmother. Lung cancer sucks because it kills you usually within 3 to 6 months. I remember talking to my grandmother after she was dying of lung cancer, and she said, put a wet washcloth over your mouth and try and breathe. That's what it feels like. And I was like, so I would go home as a kid and try to empathize with her. And it was like, that really is hard. You can get just as much air in, you can get just as much air out, but it takes a lot more strength. And so asthma is, you have a narrowing airway, and so it takes you longer to get the air out. You might, your pulmonary function test, your normal pulmonary function test might be normal, but it takes you longer to breathe. All right, so that was fairly intense of a drawing, maybe. But again, my thing is, I keep trying to get my daughter to do a Pomodoro technique. I'm going to keep encouraging you to do Pomodoro. Take 10, 15 minutes and get these down. And then if you have them down, I mean, they're pretty simple, but it does take a click moment. Then once you have those down, move on to chapter 2. And make sure you really get Boyle's Law, because I'm going to be looking for Boyle's Law in your ventilation disorders. If you are reading through Wikipedia and you give any indication that mucus or fluid or scar tissue is involved, you have to use Boyle's Law. And keep in mind that inflammation means fluid. So if you have inflamed lungs, you have fluid in the lungs. All right. I think we'll do external. They do get easier from here, but we'll do external and then we'll call it a day. So maybe while I'm getting ready, you pull out another sheet of paper. And again, I'm a big fan of just redundancy. So I'm going to write ventilation, external respiration, transport, internal respiration, and cellular respiration. And here we're going to do external. And it kind of gets I won't say random, but different. We're going to do gas laws, and there's 2 gas laws that we need to know. And then we're going to do matching perfusion, which is blood flow, to ventilation, which is airflow. And your lungs are, we're alive, so it does it pretty well. But it's one of those things that the lung could do better. And then additional barriers. At the respiratory membrane. Sorry, I need a drink. Okay, so the first law is Henry's law. And you want to know this one because it has to do with things like the bends and also just that we're surrounded by nitrogen. So Henry's law basically says that gases do not go into solution equally. And I like to represent it this way. So I'm going to go back to blue because that's our air. And I'm going to write atmosphere right here. Around us, I'm going to write this really big to show that there's a lot of nitrogen in the air around us. There's less oxygen and less CO2. But if we then come down here to, don't have a good blood color. Sorry. We'll make this blood. In blood, everything flips. And it's because if this is the respiratory membrane right here, so this is the resp membrane. Nitrogen is very bad at this. O2 is better, and CO2 is even better. So CO2 likes to go into solution, and that's going to matter because CO2, in fact, we're going to write it right here, is that leave a little space here because I want to write some stuff. Well, we'll do this, 2% in blood. 2% of your oxygen is in blood, whereas 7% of CO2 is in blood, is dissolved right in blood without hemoglobin or anything. And so the reason you're going to want to know these is this is going to come up over and over and over, is you're going to want to just commit this to memory. CO2 is acid. And acid, we'll talk about this when we get to the urinary system, and I don't know if I mentioned it before. The urinary system is the most difficult system in AP2. CO2 equals acid, and acid affects potassium. These are downward arrows. And then I'm going to draw these really, I'm running out of space. I'm going to draw these really quick right in here. Remember these. Those are action potentials. And remember, those action potentials are definitely affected by potassium. I mean, we could write it. I guess I have it on my drawing, but you might also know about nitrogen because nitrogen doesn't like to be in solution. And so you can push it into solution if you put yourself in a high pressure situation, like you dive deep. But then as soon as you come up, you need to come up slow. Otherwise, that nitrogen will come out of your blood really fast and cause bubbles to form. And those bubbles can cause embolisms and strokes. Kind of shorted myself on space down here, but we can do it. You also kind of want to know Dalton's law. Especially if you're asthmatic. What Dalton's law is that, and I don't have these memorized, so you definitely don't have to have them memorized. But I want you to get an idea of where the 760 comes from. 597 of the 760 millimeters of mercury pressure around you right now is coming from nitrogen. Then we have O2, which is 159. And then we have H2O, which is 37. And we have CO2, which is equal to 0.3. So there's not a whole lot of CO2 in the air. And that together equals the 760 millimeters of mercury of atmospheric pressure. But it's also, I do always like to go through this example. Maybe I'm biased, but I mean, it affects all of us. I have asthma. I don't have real bad asthma, but I definitely have it enough to know that temperature and humidity affects oxygen. So if you have a dry, cool room, O2 is about 160 millimeters of mercury. But if you put water in the air, it displaces some of the oxygen. So this is why those of us that have breathing problems, we like to run the air conditioning because you get rid of the humidity and you cool the air. Whereas if you have a humid, hot air, then the amount of oxygen in it is only 150. So this is why if you're having breathing problems, this is why you like cool, dry air, because you actually have more oxygen in that air. Two more things to go. Running out of space a little. So what we're going to draw here is an alveolus. And then I guess I'll use red for blood, capillary. So you're going to have a capillary going along here. That says capillary. And I don't know if it was clear, but here I've drawn a really large alveolus. Here I'm going to draw one a little bit smaller. And I'm going to draw the capillary smaller too. So the point here is you want to send air and blood to the same place. I don't know if I have enough space. I'll squeeze it in here. But like if this is a lung, the oxygen tends to come in because this is the beginning of where the oxygen is, and it fills up the top of the lung. Whereas because of gravity, blood tends to fall to the bottom. So gravity follows, blood heads into the lung and goes downward because of gravity. But the air tends to be in the top of the lung because that's where it's entering the lung. So what we're doing here is we're going to put what's happening in the bronchiole, so the airway, what's happening in the lung capillary, Definitely didn't spread things out as well here. And then what would happen in a systemic capillary? So first we're going to say, well, what if that alveolus has lots of oxygen and little CO2? So that's why I made it big, because it's full of oxygen. Then what the bronchiole will actually do is it'll say, I'm good with air. So the bronchiole will constrict. So if you already got full of air in there, if you already have plenty of air in there, you don't need a big bronchiole. So this bronchiole will get smaller because it's already full of air. The lung capillary will dilate because we want, this is going to dilate because we want blood coming into that alveolus. But that's the opposite of what would happen out in the rest of the body. Out in the rest of the body, if you have lots of oxygen and you have low CO2, you don't want to send blood that way. And so don't waste blood. Don't waste blood on well-fed tissue. It sounds weird to say it that way, but it's true. Here, we're going to say, bring blood to the oxygen. And here, plenty of O2. Send air somewhere else. Send blood elsewhere. Now, everything is going to be opposite down here, because down here, you're going to have low oxygen and high CO2. And so what you want to do is dilate. Dilate bronchiole. That says dilate. It doesn't look like it says dilate, but it does. Because we want to bring air in. And then you're going to constrict lung capillaries, because why bring blood to a part of the lung that doesn't have oxygen? And out here you would dilate. Now there's some reasons to know this, and one of them goes back to something I've been harping on a long time, and that is that lung disorders are hard on the right side of the heart. Because if you have asthma, your blood vessels are always constricting, and that's hard on the right side of the heart that has to pump blood through there. I like this one too. I don't know if we've shown it. I think I've shown it before. Clubbed fingers. If you have poor nutrition, and it could be a problem with the lungs, it could be a problem with the digestive system, it could be a problem with the cardiovascular system, then you won't have poor nutrition. You will have poor nutrition at fingertips. So they dilate and swell. So if grandma has big, like ET, I don't know if anyone's seen ET, big swollen fingertips, then that can be a sign that you don't have enough nutrition. And then on my original drawing, I put migraine, but I'm just not comfortable like defending that one, because my theory on migraine has always been thunderstorms, or this whole COVID season too. It seems like I'm having trouble breathing, which means I have less oxygen in my brain, which means I have more CO2 in my brain, which causes blood vessels to dilate. And when blood vessels dilate, you've got more blood in your brain, and that causes swelling, and that causes pain. But there is some evidence too that people's migraines go away if they rebreathe their air. So breathe into a paper bag, but that would actually increase CO2. So migraine is one of those things that's clearly it's different in different people. All right, I did not leave myself much space here at all, so hopefully you left yourself more space. But this last one is the cluster mess of, I gotta get this oxygen into a blood vessel. So this is blood. And I need to get this oxygen into the blood. And there's three main things that can go bad. One is you've got fluid in your lungs. So here's where I just use the word cluster mess so much. Because remember from ventilation, that fluid already makes it hard to take a breath in. Fluid is sticky, it's cohesive. You can't increase volume, you can't decrease pressure. You can't decrease pressure, you can't breathe in. But now if you have extra fluid, then that's an additional barrier. So fluid is an additional barrier between O2 in lungs, O2 in alveolus, and blood. I'm gonna kind of cheat on this one just to save space. And now I'm gonna make it mucus. And I'm gonna write mucus. Sorry, I ran out of space. But so the point here is to show that mucus can also be a barrier between O2. So what I'm trying to say is both fluid and mucus make it hard to get that oxygen in there in the first place. But then it's also lining the alveolus. So it's another barrier between oxygen that you finally got into the alveolus, but now you can't get it into the blood. The last one's a little bit tricky to draw. But what happens in emphysema, sometimes I get lazy and I draw these kind of, I don't draw all the little small balls of air. What happens in emphysema is all those air bubbles pop. So the alveolus gets really big. So this is emphysema. So now you end up with oxygen in the middle of this big alveolus. So I'm going to try and tuck it in down here. Hopefully you have a little bit more room than me. In emphysema, alveoli get really large, and O2 is too far from the capillary. So that oxygen will get breathed out before it ever has a chance to make it to the blood. Okay, so there's three things with additional barriers. Additional barriers are once I've got oxygen in the alveolus, what's going to keep it from getting in the blood? Extra fluid in there would keep the oxygen from making it to the blood. Extra mucus in there would make it harder to get from the oxygen from the alveolus into the blood. Or in emphysema, the air sacs pop into really big alveoli. So there's kind of a dead space in the middle of the alveolus where the air will get breathed in and breathed out before it will ever make it to the blood. Okay, so I know we have time, but I don't think we have mental energy left. And so the next, I mean, again, you could always go watch the video if you're not going to be able to make it on Wednesday, but we'll finish drawing this on Wednesday. Transports looks complex, but it's pretty easy, and especially since we've already covered the anemias down here. And we'll cover, this one's pretty cool, how hemoglobin knows how to drop off oxygen at tissue that needs oxygen. And then the last two drawings, internal and cellular, are fairly simple. They're pretty simple. I mean, this one's actually internal and external is drawn here. And so we'll draw that Wednesday before class. But I think we've probably drawn enough for today. Any questions? Are y'all asleep? I'm sure Ewing is. Is she sleeping through the night? You're muted.
And if you call like 3 hours, sleep.
I don't know if people have told you this. You're going to hear the same advice thousands of times, but I'll tell you that you turn dumb and you don't realize you were dumb. Like you just turn dumb when you don't have enough sleep.
See, I think I'm like on the verge of that already half the time, so it's not helping.
It's amazing though, isn't it? It's amazing like how you
Oh man,
find the
it's
energy.
the best.
You find the energy. Yeah, awesome. Congratulations.
Thank you so much.
Yeah. Anyone else have any questions? I think I'm going to stop recording.